Most strokes do not come out of nowhere. They send a warning, sometimes hours before, sometimes days before, and almost every person who later had a stroke, when asked afterward, remembered feeling something different in the days before it happened, something they dismissed, something they assumed would pass. Today we are going to describe exactly what that something feels like, in plain words, so you recognize it immediately if it ever happens to you or someone you love. Because recognizing it in time changes everything. Before we get into the warning signs, let me give you one number: 80%. That is how much a stroke risk can be reduced when a warning sign is caught and treated in time. 80%. That means the majority of strokes that happen to seniors are potentially preventable, not after the fact, before. In the window that the body opens, sometimes hours, sometimes days, before the main event. That window is what we are talking about today. Warning sign 1. Sudden weakness on one side of the body. Not tiredness, not general heaviness, one side only. The right arm feeling suddenly weaker than the left. One hand that cannot grip the way it normally does. One leg that feels unreliable for a moment when you stand. This is not a pulled muscle. This is not sleeping on your arm wrong. This is one half of the brain briefly losing its blood supply. The left brain controls the right side of the body. The right brain controls the left. When one side is affected, the opposite side of the body shows it. It may last 2 minutes. It may last 10 minutes. Then it clears. And that is the most dangerous part. It clears. You feel normal again. And you think, that was strange. And you move on. Do not move on. That clearance does not mean the danger passed. It means the warning fired, and you are still inside the window. Warning sign 2. Sudden vision change. Not tired eyes. Not needing new glasses. Sudden loss of vision in one eye. Like a curtain dropped over half of what you can see. Or sudden double vision that appeared from nowhere. Or a dark spot that was not there before. The artery that feeds the eye is a branch of the same system that feeds the brain. When it gets temporarily blocked, the vision cuts out. It comes back. And people assume it was nothing. It was not nothing. Sudden vision change that comes on instantly and then resolves, especially in one eye, is one of the most specific early warnings of stroke that exists. Warning sign 3. Sudden severe headache. Not a tension headache. Not a sinus headache. Not the headache you always get when you are stressed. This headache arrives at full intensity immediately. No buildup. No warning of its own. People describe it as the worst headache of their life. A thunderclap inside the skull. This specific type of headache, arriving suddenly at full intensity, can indicate bleeding inside the brain. Do not take a painkiller and lie down. Call emergency services. Warning sign 4. Confusion that came on suddenly. Not the forgetfulness of aging. Not losing your train of thought mid-sentence. A sudden, dramatic confusion. Not knowing where you are for a moment. Not being able to follow what someone is saying when you normally would. Saying something that does not make sense and not realizing it. Or someone near you suddenly seeming confused, responding slowly, or saying strange things out of nowhere. Sudden confusion, appearing without any other obvious cause, is the brain struggling with reduced blood flow. It can last minutes, it can be subtle, and it is extremely easy to dismiss as tiredness or stress. It is not. Warning sign 5. Sudden loss of balance. Not regular dizziness, not the inner ear issue we have covered before. This is a sudden, dramatic, unexpected loss of coordination. Standing normally and suddenly unable to control your steps. Reaching for something and missing it. A stumble that was not caused by anything on the floor. Combined with any other sign on this list. This is an emergency. Now. Something important. Each of these signs on its own may have another explanation. But here is the rule that will save a life. If any of these signs appeared suddenly, not gradually, not over days, but suddenly, and it involved one side of the body, one eye, or came with sudden severe head pain, treat it as a stroke warning until proven otherwise. The cost of being wrong and calling emergency services unnecessarily is a few hours of your time. The cost of being right and not calling is permanent brain damage, or death. There is no version of this calculation where waiting is the right choice. There is a tool called Be Fast that emergency doctors use. It is easy to remember. B, balance. Did they suddenly lose it? E, eyes. Did the vision suddenly change? F, face. Is one side drooping or numb? Ask them to smile. Does one side not move? A, arms. Can they raise both arms? Does one drift downward? S, speech. Is it slurred? Are the words wrong? Can they repeat a simple sentence? T, time. Time to call emergency services. Right now. Any single letter. Any single symptom. Call. Do not wait to see if it gets better. Do not drive them yourself. Do not give food or water. Call emergency services and tell them you suspect a stroke. Those words, "I suspect a stroke," activate a specific fast-track response in every emergency department. A stroke team, a brain scan within minutes, clot-dissolving treatment that is only effective within a very specific time window. Every minute of delay is brain cells lost permanently. Now let us talk about the day or days before. Because beyond the acute symptoms, there are subtler things that seniors report feeling in the 24 to 48 hours before a stroke. Unusual fatigue that is different from normal tiredness. A heaviness that rest does not improve. An unusual headache. Not the thunderclap of a bleed, but a headache that is different from their normal headaches. Feeling slightly off balance when walking. Not dramatically, just slightly less steady than usual. A general sense that something is not right. Difficult to name, difficult to explain, but clearly different from how they normally feel. These subtler signs do not trigger emergency services on their own, but they do warrant a call to a doctor. They warrant telling someone. They warrant not dismissing. Because in retrospect, after a stroke, these are the things people remember noticing and saying nothing about. Before we finish, two things that matter as much as recognizing the signs. The first is knowing your own risk. High blood pressure is the single largest risk factor for stroke. If you have high blood pressure, take your medicine every day, every single day, not most days, every day. Atrial fibrillation, the irregular heart rhythm we have talked about, multiplies stroke risk by 5. If you have AFib and you are not on a blood thinner, please discuss this with your doctor urgently. Diabetes, high cholesterol, smoking, all significant factors. Knowing your risk means knowing which number on your blood pressure monitor needs immediate attention. Knowing whether your heart rhythm is regular. Knowing whether your diabetes is controlled. These are not abstract numbers. They are the specific things that either keep the arteries clear or allow the conditions for a stroke to build. The second is having a plan. Before you need it, know the number for emergency services. Know that you call them, not drive to the hospital. Know that you say the words, "I suspect a stroke." Know the be fast signs well enough to use them in a moment of panic. Because when a stroke is happening, either to you or to someone near you, your brain may already be affected. Confusion is one of the symptoms. The time to think clearly about what to do is now, not then. Today we covered what a stroke feels like before it happens. Sudden one-sided weakness, sudden vision change, sudden severe headache, sudden confusion, sudden loss of balance. The Be Fast tool, what to say when you call, why you call emergency services instead of driving, the subtler signs in the 24 to 48 hours before, unusual fatigue, different headache, slightly off balance, a sense that something is wrong, and the two things that matter as much as recognition, knowing your risk factors and having a plan. Share this video today, not next time you think of it, today, because the person who needs this most is probably not going to search for it themselves. They need someone who cares about them to put it in front of them. That someone is you. Subscribe for a new video every week. We will see you next time.